Greetings, Trent Zelenik here, Director and Supervising Manager of Agape Home Care. This training exercise provides knowledge and skills on safety precautions, protocols, and procedures associated with the coronavirus or COVID-19 pandemic. This training material is time sensitive, so let's get started. Regarding the stay-at-home orders and essential services workers, caregivers are part of essential services to the community and are therefore permitted to continue working. Agape Home Care staff who are willing and able to serve our clients and who are symptom-free of COVID-19 are requested to continue helping us meet the home care needs of our senior population through this difficult time. Thank you to all of our staff for partnering with us in this effort. Regarding mandatory health conditions for serving our clients, in order to provide direct care services to seniors, caregivers must be symptom-free of COVID-19. Symptoms such as sore throat, shortness of breath, fever, or a persistent dry cough are prohibited health conditions and must be reported immediately to your supervisor. Again, if you're exhibiting any of these symptoms, you are not permitted to work until you are healthy. Regarding mandatory health screenings and daily reporting. During the COVID-19 pandemic, caregiving staff are now required to file a daily personal health screening report to confirm that they are symptom-free, that they've not traveled or had contact with travelers outside the United States within the last 14 days, and they have not had direct contact with anyone known to have COVID-19 within the last 14 days. Personal health reporting is done online and is required to be submitted prior to reporting for duty, preferably early in the day, but regardless, before your shift begins. Those who are unable to report online must either call the administrative line for a verbal report or text the urgent line to make their daily health screening report. One thing you can say in a text is, I am symptom-free, I've had no contact with travelers outside the U.S., or anyone with confirmed COVID-19 in the last 14 days. Regarding mandatory reporting of COVID-19 symptoms, both for yourself and your clients. During the COVID-19 pandemic, caregivers are required to health screen their clients and members of their household upon arrival to their assignment to confirm that they are symptom-free, that they have not traveled or had contact with travelers outside the United States within the last 14 days, and that they've not had any direct contact with anyone known to have COVID-19 within the last 14 days. If a client or member of the household responds yes to any of these questions, step outside, call your supervisor, me, for further directives. Regarding mandatory personal protective practices and equipment while serving our clients. During the COVID-19 pandemic, caregivers are required to practice heightened level of personal protection practices until further notice, not only for themselves, but also for the benefit of those that they serve. The first line of personal protection is always maintaining clean and sanitized hands. Caregivers are to follow proper hand washing protocols while providing care for those that they're serving. Caregivers must wear a face covering at all times while on duty, applying before they enter the client's home, changing between assignments whenever possible, and following proper masking protocols while applying, removing, and discarding face coverings. Cloth masks are reusable and should be washed in hot water with detergent and dried thoroughly before recycling. Caregivers are required to wear latex gloves at all times while on duty, changing gloves between various tasks and following proper gloving protocols while applying, removing, and discarding gloves. Caregivers are required to clean and sanitize frequently touched hard surfaces daily during their shifts, following proper cleaning and sanitizing protocols. Protocols for proper hand washing, masking, gloving, and infections control are all covered in a separate training session entitled Infections Control. This concludes the video portion of the coronavirus or COVID-19 training. At this time, review the Understanding Coronavirus document directly below this video screen. If you're unable to download and view this document, a copy of it can be obtained at the administrative office. After reviewing this information, complete the short quiz, also below this video, to verify that you have read and understood the information contained in this training. Thank you for being part of the Agape Home Care team and for serving those seniors who so desperately need us. You are valued and appreciated.